Welcome students to the last of our lectures on the skeleton, this time looking at the detailed markings of the appendicular skeleton, starting with the pectoral girdle, which is what attaches the upper limb to the axial skeleton. There's two bones, the scapula and the clavicle. The clavicle is your collarbone. You'll see this blunt end here is the sternal end where the clavicle attaches to the sternum, whereas this rounded end here is the acromial end, which is where the scapula attaches to the clavicle. On the inferior side of the clavicle, you'll see the conoid tubercle, this little point where some muscles attach. The clavicles sit flat in the body, and so the diagrams will always show you a superior and inferior view, not anterior and posterior like most of the other diagrams. Oh, I'm going to go back and look at the scapula there for a second. We weren't quite done. When it comes to your scapulae, you want to look for kind of which side of the body it's coming from. It's one of the things you want to be able to do to differentiate between anterior and posterior. You can look for the acromion, and then attached to the acromion is this long spine, big spine that goes across the back of the scapula. That's the posterior scapula. And then the glenoid cavity here, which is the socket for your humerus, your arm bone, is then on the lateral side of the scapula. The medial side of the scapula is then towards the middle, more towards the middle of the body. The acromion is where the clavicle attaches, and then the coracoid process here, which is also very anterior, is a muscle attachment point. If we look at the arm bone, the humerus, proximally we've got the head of the humerus and two tubercles here, greater and lesser tubercles for some muscle attachment. We've got the deltoid tuberosity here, which is where your deltoid muscle inserts, and then distally we have two condyles, the trochlea here and the capitulum here. The trochlea connects to the trochlear notch of the ulna. The capitulum connects to the head of the radius. Atop both of those condyles, we then have two epicondyles medially and laterally for some muscle attachment points. You also have two fossae on the distal end that allow the elbow to bend. The coronoid fossa is in the front. The olecranon fossa is in the back. When you flex your forearm, the coronoid of the ulna inserts into the coronoid fossa. When you extend your forearm, the olecranon of the ulna goes into the olecranon fossa here on the humerus. So let's take a look at the ulna so you can see what I'm talking about. Here is our two forearm bones, the medial ulna and the lateral radius. Here is our trochlear notch that attaches to the trochlea on the humerus, with the olecranon or the elbow on the back and the coronoid process on the front. Again, when you flex your forearm, the coronoid process inserts into the coronoid fossa. When you extend your forearm, the olecranon then goes into the olecranon fossa on the humerus. Down here on the head of the ulna, you'll see an ulnar styloid process, and then here you'll also see a styloid process on the radius that helps kind of bracket your wrist. You'll also see two notches. The notches always tell you what goes in them. So up here, we have the radial notch on the ulna because the head of the radius goes into the radial notch. And then down here on the radius, we have the ulnar notch so that the head of the ulna goes into the ulnar notch on the radius. If we look at the bones of the hand, you'll see 8 carpals in 2 rows. The best way to remember them is to do one of those mnemonics. The first row, we have the scaphoid, the lunate, the triquetrum, and then the pisiform. And then in the second row, we have the trapezium, the trapezoid, the capitate, and the hamate. The metacarpals are labeled 1 through 5 with Roman numerals, with Roman numeral 1 being the metacarpal that goes out to the thumb. There are 14 phalanges, 3 per finger, a proximal phalanx, middle phalanx, and distal phalanx, except here in the thumb where we only have 2 phalanges, a proximal phalanx and a distal phalanx. And that is the upper limb. If we look then at the lower limb and the pelvic girdle consists of the coxal bones, the hip bones, plus the sacrum. So that portion of your spinal cord also contributes to the pelvis. The hip bone itself, the coxal bone, is 3 bones that have been fused together. This large ilium here, which is the flared portion, the pubis, which is the more anterior bone, and then the ischium here, which is the more posterior bone. If we look at the ilium here, you'll see this nice iliac crust, big attachment point for some muscles. You'll also see the greater sciatic notch right here. That is where the sciatic nerve exits the pelvis to go down the posterior side of your leg. You'll also see kind of on the interior of the ilium, what we call the auricular surface. That's where the sacrum attaches into our sacroiliac joint. If we look on the ischium, you'll see an ischial spine here for some muscle attachment that then makes a lesser sciatic notch for some nerves and blood vessels to pass out of the pelvis and down the leg. And then this roughened portion down here is known as the ischial tuberosity, and that is actually what you sit down when you sit down on your tuchus. Up here in the front, in the pubis, we really only have one major marking, and that's the pubic symphysis, which is the connection between the 2 pubic bones. You'll also see this very large, deep socket called the acetabulum. It's all 3 bones that contribute to that. It's very deep. That is your socket for the head of your femur to make your hip joint. And then this very large hole is the obturator foramen, and it is a passageway for nerves and blood vessels to get out of the pelvis and travel down the leg. If we look at a female pelvis versus a male pelvis, it's definitely one of the things that you want to do. When it comes to trying to figure out which one is which, what is the one thing that women do that men don't? That, of course, is childbirth. So the female pelvis is adapted for childbirth, so it's tilted more forward. It has a very broad, kind of oval-shaped pelvic cavity, a very wide pubic arch, and then the sacrum tends to be shorter. It's not as curved. Whereas the male pelvis, since they don't have to go through childbirth, it's more adapted for kind of bearing the generally larger kind of upper body build. It's not as tilted as far forward. The brim and the cavity is much narrower, more heart-shaped, very narrow pubic arch, and then the sacrum and coccyx tend to be very long and very curved. There's a nice little table in exercise 10 that kind of compares them on a one-to-one basis. You definitely want to be able to tell the difference between a male pelvis and a female pelvis. If we look at our thigh bone, you'll see here is the head of the femur. That's what goes into that acetabular socket to make your hip joint. You'll also see these 2 very large trochanters here, these very large kind of blunt processes. These are attachment points for your very large kind of thigh muscles. More distally, we have the medial and lateral condyles. For attachment with the tibia. Posteriorly, we have the intercondylar fossa. Anteriorly, we have the patellar surface, where the patella goes. And then the patella itself, the kneecap, just sits right over that patellar surface. And so when you're trying to determine whether you have a right femur or left femur, you can look for the patellar surface in the front or the intercondylar fossa in the back, and then know that the head is going to be more medial, and then you can determine whether you have a right femur or a left femur. If we look at the 2 leg bones, we have the weight-bearing tibia and the non-weight-bearing fibula. And all of your body weight goes from your upper body into the pelvis, onto the femur, and then onto the tibia, not the fibula. Proximally, we have a medial and lateral condyle that connect to the medial and lateral condyles on the femur. You've got this tibial tuberosity here, which is where your patellar ligament attaches to stabilize your patella. And then distally, you've got the medial malleolus, which makes up kind of the medial middle part of your ankle. On the fibula, the head of the fibula attaches kind of towards the back in the tibia, and then the lateral malleolus down here brackets the ankle on the lateral side. If we look then at the foot, there are 7 tarsals. The largest of these is the calcaneus, or your heel bone, and then the talus here actually receives all the weight of the body, transferring from the tibia into the foot via the talus. The other tarsals are the navicular, the cuboid, and then the 3 cuneiform bones, medial, intermediate, and lateral, just kind of telling you where they are in terms of the 3 cuneiform bones. Again, the metatarsals are labeled just like the metacarpals, 1 through 5 with Roman numerals, with Roman numeral 1 being the metatarsal going out to the big toe. 14 phalanges again, 3 per toe, proximal, middle, and distal, with the exception of the big toe. It only has a proximal phalanx and a distal phalanx. And that is it. That is our skeleton. It really is basically a big giant human jigsaw puzzle. And I know it gets really overwhelming to a lot of students, but I'm telling you, if you just take it in small pieces, kind of focus on just one part of the body at a time, you can definitely do it.